Hello there, I'm Dr. Lai Kok Wing, an oral maxillofacial surgeon, and welcome to the National Dental Centre, Singapore. Here at the NDCS, we don't just deliver the usual dental treatment such as cleaning, fillings, dentures and crowns, but we have teams of integrated multidisciplinary specialists that look after patients with complex dental needs and who may even require oral or facial surgery. In this program, I will discuss the services of our Orthodontic Surgery Centre, which attends to patients who may need corrective jaw surgery. Common conditions that may require this treatment include developmental jaw deformities, jaw deformity due to jaw tumours or facial fractures, obstructive sleep apnea, and jaw joint disorders. Today, I have a patient who is seeking treatment at our centre for her jaw deformity. Her jaw condition is developmental and usually becomes apparent after puberty. As a result of a severe underbite, she has significant functional problems, including speech and chewing difficulties. Furthermore, her lower lip is protruded and is unable to come into contact with her upper lip.
Hi, I'm Priscilla. I have an underbite problem. It causes chewing and speaking difficult. Because of my upper front teeth and my lower front teeth doesn't align properly, I have to cut my food into smaller pieces so that I can put it at the back of my mouth to chew. This means that I take longer time to finish my meals. Prolonged chewing causes stress and discomfort on my jaws. When it comes to speaking, I have difficulty pronouncing certain words accurately and have to repeat myself, which is rather annoying. Many times I get unfriendly stares from strangers because of how I look. I hope by getting my jaw aligned through corrective jaw surgery, I can gain better in confidence in speaking and improve my quality of life.
In this case, Priscilla needs braces and jaw surgery to correct her condition. Braces alone will not be able to achieve an acceptable result. With the use of a full suite of 3D technology, patients can conveniently complete their facial records in one sitting. What used to take a few visits over 2 weeks now only takes an hour of the patient's time. In the total management of a jaw deformity case, there are 3 phases to it. The first phase is using braces to align the teeth. The second phase is to correct the jaw through surgery. Braces are used again in the final phase to refine the alignment of teeth with the corrected jaws. 3D imaging and planning begin right from the first phase. Even before braces are fitted, plaster models are made to capture the teeth alignment of the patient. These models are then converted into high-resolution 3D images through a 3D scanner. With these images, it enables braces specialists to simulate how the braces will shift and reposition the teeth digitally. Measurements taken from the simulation are then used to plan the treatment. Accessible to multiple users on the server network, this 3D dental image will be used later to plan for the corrective jaw treatment. Once the patient's teeth are repositioned correctly, the surgeon starts planning the jaw surgery. The patient has to go through 2 imaging scans that take less than 10 minutes. The first imaging scan is a cone beam CT scan that can produce very precise images of the patient's facial shape and bone structure. The second scan is a 3-dimensional color photograph of the patient's face. This is then mapped onto the first scan using our software to create a combined image, which gives an accurate facial appearance of the 3D radiographic scan. The 3D dental image of the teeth is fused into this combined image to register the bite. Eventually, we have a 3D virtual face of the patient to enable precise diagnosis and prediction of the treatment outcome. On the 3D virtual face, we can simulate different treatment plans to see how the surgery will impact the bite and facial appearance. We can also see the internal jaw structures and the associated vital structures such as nerves and roots of the teeth. This helps us to reduce risks and potential complications from the surgery. With the simulated images, I can also better explain to my patients what I'll be doing during the surgery and how their bite and face will change afterwards. Once surgical planning is completed, surgical templates in the form of wafers are produced using 3D printing technology. These templates act as blueprints to replicate the simulated jaw movement during surgery. For patients with jawbone tumors needing surgical removal, we use the same 3D imaging and simulation technology to print the 3D models of the patient's jaw. Using this information, we measure and identify the size and location of the tumor before surgery. This helps us to precisely plan the resection margins and translate that into actual surgery. After cutting out the diseased bone, reconstruction plates are used to stabilize the remaining parts of the jaw. With this technology, we can now pre-bend the plates according to the 3D models before surgery, which means shorter surgery time for the patient and lowering the risk of plates weakening and potential fractures as a result of inaccurate repeated bending. At the National Dental Centre Singapore, we are always looking for ways to improve the care that we provide. Using technology, we aim to make our treatment safer, faster, and more precise for our patients.